Hey everyone, my name is Katrina. I'm a pelvic floor physical therapist, and in today's video, I'm going to talk about the importance of having good pelvic mobility. So, when it comes to pelvic mobility, why is it important? So, having good pelvic mobility is important because it can help prevent and address issues like lower back pain, pelvic, tailbone pain, sacroiliac joint pain, hip pain, knee pain, foot pain, pretty much any pain in the body. Now, a lot of patients that I see are very stiff in their pelvis. And when the pelvis is very stiff or kind of locked up or not moving very well, then your body is going to move above and below the area of restriction. So your pelvis is right here. If your pelvis is not moving very well, you're probably going to overmove or move too much in your lower back or your knees and your feet. As an example, when I see people do a squat and their knees tend to cave in, I may be thinking they might have limited pelvic mobility. If I see them squat down and they tend to tuck their pelvis at the bottom of the squat or tuck their tailbone, I'm thinking they may also have stiff hips and a stiff pelvis. So, having good pelvic mobility can help prevent aches and pains or address these aches and pains around around neighboring areas of the pelvis. Having good pelvic mobility is also really important for labor and delivery. Especially, you want your pelvis to be nice and mobile so that it can accommodate the baby during all different stages of labor. So, those are just a few examples of why it's important to have good pelvic mobility. So, now we're going to talk about the different movements that the pelvis should be able to do. So, your pelvis is this structure right here at the base of what you're sitting on. And your pelvis should be able to move forward and backward, so almost like an anterior tilt, so arching your back motion, and then a posterior pelvic tilt, so tucking the tailbone. Your pelvis should also be able to rotate left and right. So when you're walking, your pelvis rotates, and it should also be able to hike up and down, so like move up and down. So I don't have my model with me, but really in essence, if this is your pelvis, it should be able to move forward, backward, rotate left and right, and then hike up and down. So those are, in essence, the three, planes of motions that your pelvis should be able to move in. If your body is stuck or can't move into that anterior and posterior pelvic tilt or the rotation or up and down, it's really just stuck and it's not moving well. And that's really important to address because by releasing the pelvis, it can help release a lot of tension in other areas of the body and also ease a lot of aches and pains in nearby areas of your body. So that's a little bit in terms of what the pelvis should be able to do and the planes of motions it should be able to incorporate in its day to day. Now, most of the time when I see people, they tend to really just do the same type of strength training workouts, whether that is squats, lunges, and they tend to work in this forward and backward plane of motion. They don't do as much rotation or lateral movements, which actually gets that pelvis to move in all planes of motion. So if you're just doing more forward and backward movements, you may be getting that anterior and posterior pelvic tilt. But if you're not adding rotation or lateral movements into your workouts, you may not be getting that pelvic rotation or that hip hiking or that pelvic hike motion into your day to day. So, having a variety of movements in your workouts is really important so that you can improve your pelvic mobility. So, if you're thinking about, again, how can I improve my pelvic mobility? Just think about your current workout routine. Do you tend to only work in that forward and backward plane of motion? Or do you diverse your workouts so that you're moving into rotation, maybe into some lateral lunges or some lateral movements? So that's what you can kind of start to think about when you're thinking about, is my workouts reflecting those movement opportunities so that I can move in all planes of motion? So we kind of talked about the importance of pelvic mobility, the different movements of the pelvis, and how you can optimize your workouts to get more pelvic mobility incorporated. And in this next part of the video, I wanted to give you a few exercises that you can do to help target and improve your pelvic mobility. So the first one we're going to do is with our 2 orange Franklin balls. So these are my 2 orange Franklin balls. And now these are great balls because they are perfect for doing something called the pelvic clocks. So I love the pelvic clock exercise, one of my favorite assessment tools as a physical therapist, but also as an exercise for my patients. So we're gonna have you hop onto the mat and we're going to have you lay on your back, and you are going to place those 2 Franklin balls underneath your pelvis. So you don't want them to be too low, otherwise you're going to be tucked. You also want them to be too high, otherwise you're going to be arched. So you want them kind of like in your mid glute on either side or both sides of the sacrum, and you want your pelvis to be in a neutral position. Now, what we're going to start with first are just pelvic tilts. So we're going to move our pelvis in all 3 planes of motions, just like I described before. So we're going to tuck, and then we're going to arch. Now, the important thing about this is that you want to make sure that you aren't moving your ribs. So this rib cage here shouldn't be moving. It should be, all this movement should be coming from the pelvis, because what you're working on is pelvic mobility. So again, what really helps is just placing your hands on the rib cage, and then you're going to tuck your pelvis, and then you're going to arch. Now again, you want to isolate this movement from the pelvis. You may notice that one direction is easier than the other. So for me, the tucking tends to be a lot easier. The arching is a little bit harder. So for this motion, we're going into anterior and posterior pelvic tilts. We're working in the forward and backward plane of motion. And now we're going to go side to side. So now we're going to rotate. Now you want to think about, you don't want to move your pelvis side to side. You want to rotate it and keep it in that plane of motion. So you almost want to think about dropping your left pelvis back as your right pelvis comes forward, and then you drop the other pelvis back and the other side comes forward. It's not a side to side motion, it's a rotation. So you're thinking about moving only from your pelvis, again, keeping your ribs stable. You shouldn't be seeing a lot of rib motion here. That would be too much. Again, you just want to isolate that movement coming from your pelvis. So again, having your ribs here really helps with that motion. And again, this can be hard for some people. If you have really tight glutes or butt muscles, or if you have tight hip flexors, this can be very challenging. So that is the pelvic rotations. And now we're going to do the hip hikes. So we're going to move up and down like this. So we're also going to think about lengthening and then lengthening. And again, try not to move your ribs. You're just opening up your pelvis in the up and down plane of motion. So that is one exercise you can do. Now, I highly recommend doing it with the Franklin balls. If you don't have a Franklin ball, I guess you could do it without them, but I love using the Franklin balls because it props up your pelvis and it gives you more access or range of motion that you can go through. All right, so that is the first exercise, and I do this one almost every single day. It just feels really good, and it's an easy way to bring awareness to your body. Now, many people, when they do this, they find it really hard to just isolate movement from their pelvis because their pelvis is stuck and stiff. And that's what this video is all about, is how can I improve my pelvic mobility? And again, this one is a great exercise. I also give this exercise to, I would say, majority of my clients who are pregnant as a way to prepare their pelvis for birth. So if you are pregnant in your 3rd trimester, this is a really great exercise. All right. So that is the first one you can do with the Franklin balls. The other one I'm going to show you is with the yoga block. So you are going to be on your hands and knees, and you are going to prop one of your legs on this yoga block. All right, so what you're going to do is you're going to have your wrists and hands directly over your shoulders, and then you're going to have your knees about shoulder width apart. I'm going to show you from this angle. And what you're going to do is you're going to prop both of your feet on the yoga mat, and you're simply going to hike your pelvis up and down like this. So you're going to think about keeping your ribs nice and stiff, and then you're going to move your other leg up and then down. So it's basically doing this hip shifting rotation type of motion. I don't know if you can see that very well, but I'm also going to give you from this view. So you're keeping both feet on the ground, and then you're hiking one hip, one pelvis up, other pelvis down, up and down. Now you don't want to move from your ribs, so try to keep your ribs flat, and you're making this all from the pelvis. Now this can be a very challenging exercise, but it's a really good exercise to work on that hip shifting or that pelvic rotation. So for this side, it's going to look like this. Great. So we're going to have you do that for about 10 to 15 times, see how that feels. And again, really great option if you want to improve your pelvic mobility. So that is one of my favorite other exercises you can do with the yoga block. You can also do a hip shift and a hinge. I will link that other video right now, which is a really great option to also improve your pelvic mobility. That may be a little easier than this version, but again, it doesn't hurt to have a variety of different exercises that you can do. So I hope you found this video helpful on why it's so important to improve your pelvic mobility. So again, if you are doing a ton of strengthening, whether it's core strengthening and butt strengthening, and still finding that you're struggling with lower back pain, pelvic pain, tailbone pain, hip pain, try to think about, am I doing anything to help create space or openness in my pelvis? There's so much out there on like strength training and just getting stronger and just like stiffening things up. But if our pelvis is stiff, you're just making everything more compressed and more tight and more bulky. And sometimes our body, what we really need is just a lot more lengthening. We need those muscles to kind of breathe and let go and lengthen, elongate. So just think about, am I doing that in my routine? Because you need both. Strength training is good, but there is also a time and place for working on mobility, lengthening, and elongating. So I hope you found this video helpful. Let me know if you have any questions in the comments, and I'd love to answer them.